Good morning, everyone, and welcome back. It is 8:24. It is something that could affect you or someone you know during a summer vacation. Dr. Mollen is here this morning, and we are talking about deep vein thrombosis. You may have heard of it affecting, even killing some people on long flights, and it happens to a lot of people. Thousands of people die from it each year. So
yeah,
tell me what this is.
About 100,000 people actually die from it. Now, there are almost 1 million people, Jamie, who actually will get this deep vein thrombosis, but death can actually occur, and it's due to a vein in your leg, and this vein in the leg basically it starts to deteriorate a little bit, and it's the inner lining of that vein. So for a lot of people who get these, you know, they may have an injury to something in their leg, you know, they may have banged it on something, the blood may be thicker. Pregnancy can actually be a contributory cause as well, particularly in the last 4 to 6 weeks of the pregnancy, because you have higher estrogen levels. And in fact, birth control pills, which often contain estrogen and higher levels of them, they can actually be a contributory factor as well. And menopause, people take estrogen replacement, that can be a problem. But if you're in a long flight and you're stuck for more than 4 hours in a little cramped up space, it doubles the risk of having one of these deep vein thrombosis.
Is there something, I mean, is it kind of, how would you know before you got on a flight that something was up?
You wouldn't know before you actually got on the flight. What you would know is if you started to develop pain in your calf, you had redness and swelling, particularly below the knee, that tenderness in the calf, that's often a problem, trouble breathing, a rapid heart rate, coughing, chest pain. All of those are factors and symptoms that would lead you to believe that you might have a deep vein thrombosis going on. Now, the way to diagnosis often is with an ultrasound. An ultrasound is a sound wave, and they put it on your leg, and they're able to basically determine whether or not you have a deep vein thrombosis. And the problem is that you can get a clot in the vein, and it breaks off, and it goes to your lungs, it can go to your brain, and that's what causes the major problem with it. So some of the things that you can do actually to prevent it is blood thinners. They often, if you have a deep vein thrombosis and prevent clots from going to the lungs, they'll put you on a blood thinner. It could be something like Coumadin or Eliquis or Xarelto. These are some of the newer types of drugs. Compression stockings. If you have a propensity to develop these deep vein thrombosis and you're on a flight, wear compression stockings. Elevate your legs. Get up and walk around. You know, don't be stuck in that seat, and make sure that you're well hydrated. The other thing is don't smoke, because that's another contributory factor. And if you're overweight and you're not exercising, these are other major contributory factors to deep vein thrombosis. And it's a serious problem, and perhaps more serious around this time of the year when people are taking longer flights on vacation. So be on the lookout for any pain or tenderness that you may have in the calf muscle.
So if you see that tenderness happening, you should probably go see the doc before the trip to Europe.
Absolutely. Don't wait. Go to the emergency room. In fact, if it comes on very suddenly, and if you're a regular exerciser, don't think that you're immune to having blood clots, because you could have a blood clot as well, because you exercise, you do endurance runs, you get dehydrated, and they can also contribute to deep vein thrombosis in the calf.
Very interesting, Doc. Thank you so much.
You're welcome.
If you have a question for Dr. Mollen, you can email him at askdr@gmail.com. We'll be right back, Arizona.